Joining us now is Dr. Laura Forman. She is the Chief of Emergency Medicine at Kent Hospital. Dr. Forman, thank you so much for joining us.
My pleasure. Thank you for having me.
Let's talk a little bit about what's happening in the emergency rooms across the country, including here in Rhode Island. It seems that they're declining. People are not coming to the emergency room. And you're saying that that can be quite dangerous, correct?
Absolutely. We have seen here at Kent, as we have across the country, a decline in emergency department visits, sometimes as many as 50%, as much as 50%. And we're really concerned. I do want to reassure the public that the fear of coronavirus shouldn't deter anybody from seeking emergency care. We know that there's a lot of anxiety around this pandemic, but we really want to stress to everybody the importance of coming to the emergency department if they have a medical emergency. Life-threatening illnesses need the highest quality of care performed by specialized, well-trained medical professionals in a timely manner. In a medical emergency, seconds count. Time is really of the essence. So in a heart attack or a stroke or after a major trauma, every second is important, and so we don't want people to delay coming in because of concerns. Those delays can have very serious consequences. So the important message for the public is that even amidst a pandemic, the hospital is still the safest place to be if you're having a medical emergency.
Okay, tell us a little bit about how safe it is. You know, everyone's wearing their PPE, they're taking precautions.
Absolutely.
It's a safe environment, correct?
It is a very safe environment. I know people have a lot of fears about contracting COVID-19 if they come in, but it is an unfounded fear. So we have, as a hospital, worked very hard to remain a safe and clean place for care. Keeping patients safe and keeping staff safe and healthy is in the foremost of our minds at all times. So the entire staff across the spectrum of care has been engaged in efforts to care for people and keep everybody safe during the pandemic. So we've implemented safety measures, as you alluded to take these steps. So we have strict protocols in place. Staff are all wearing masks. Anybody who enters the hospital is wearing a mask. Everybody is screened. They have their temperature taken and they undergo a health screening. Staff undergo this every single day when they come in. We have also worked very hard to put into place protocols to keep patients with COVID-19 or suspected of having COVID-19 separate from other patients. So we have rapidly expanded the number of negative pressure rooms that we have in the department, which allows us to safely isolate patients. We've also expanded training, and we're cleaning constantly and thoroughly throughout the hospital to make sure that the environment is safe for patients and for staff.
Dr. Laura Forman, the Chief of Emergency Medicine at Kent Hospital, thank you so much for this very valuable update.
My pleasure. Thank you so much.